JPA is a federally qualified health center, a community health center. It has been around for over 30 years, serving the local communities in Far Rockaway, Jamaica, Queens, and Red Hook, Brooklyn, and to provide primary care services to the population, and also dental services, OBGYN services, and behavioral health services. We are there as a community center to be there for individuals from everything from a headache to depression that they may be suffering.
And we hope to, through our efforts, improve the overall health of the community that we serve, both through intervention and also through prevention.
Since the beginning of our partnership with Yuvo, we have been fortunate enough to see improvements in almost all our quality metrics. JPA has worked with Yuvo in putting in various measures.
They're very supportive. They are very easy to get in touch with. They are very knowledgeable.
Adolescent immunizations are extremely important. We increased from 49% immunization to 57%, and we ended up being in the 90th percentile on that.
We've been able to improve those metrics by having better grip of the data, or by readily sharing data with our front desk staff and with our providers on which patients have not had their immunizations done.
We've seen an improvement in breast cancer screening from 57% to 61%.
We're able to improve our numbers by having a better handle of the data, by readily sharing care gap lists with our providers, also through the use of pre-visit planning, having providers readily know before the day begins which of their patients that are coming in need to have or are due for their breast cancer screening.
Child and adolescent well child visits are good ways to make sure that our kids are growing up okay. We're happy to say that we increased to about 54%. I think we were originally, I think it was about 26%. We have put in new workflows and systems to keep better track of the data and to know when, for example, a well child visit is due for a patient.
One of the major ways that Yuvo has helped was in our pre-visit planning workflows. They gave us a very structured approach on how we should go about building a pre-visit planning strategy. They had a team who worked both with our front desk staff and with our clinical staff, identified key people on each team at each site, gave them very defined roles, gave them, helped them with the tools that they would need to get these care gaps.
Yuvo has also helped our providers in coding the visits at their higher level of specificity and just better coding in general.
These are things that are not necessarily taught to providers in medical school. Members of the Yuvo team have scheduled both group sessions and one-on-one sessions with our providers to help them in the way they're coding and documenting.
The providers feel an enhanced sense of efficiency in their own work and feel that they're making progress, and they really trust Yuvo to help them with that. It's almost like a Yuvo University. The partnership with Yuvo has been fantastic. Yuvo has essentially become an extended arm of our provider department.
I think it's very important for us as an organization to be prepared for the transition to value-based care. I think that without Yuvo's assistance, that transition would have been a lot more difficult. So I'm very excited and very happy to have them on board to help our staff and our team not only understand the details of it, but also the why and why we're doing making these important changes to how we see our patients every day.